The Oversight Committee's mission statement is that we exist to secure two fundamental principles. First, Americans have a right to know the money Washington takes from them is well spent. And second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to protect these rights. Our solemn responsibility is to hold government accountable to taxpayers because taxpayers have a right to know what they get from their government. We will work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the Federal bureaucracy. This is the mission of the Oversight and Government Reform Committee. Today's hearing focuses on how the President's health care law affects job creators in the economy. And with our mandate to protect taxpayers' money, now that we know Obamacare is a tax, it is particularly important that we protect that money. This hearing builds on previous hearings conducted during the Congress by Subcommittee Chairman Gowdy, including one this morning. Dr. Goodman.
Mr. Chairman, members of the committee, the Affordable Care Act will impose very high costs on the private sector of our economy. The minimum health benefit for a family will cost almost $6 per employee per hour. When you combine that health minimum wage with a money minimum wage, it means that employees will have to produce at least $13 of goods and services every hour, or they will be priced out of the labor market. That is why hundreds of thousands of low-skilled workers are in danger of losing their jobs. The Act will impose about $500 billion in new taxes over the first 10 years, and it will do so in ways that will reduce investment, reduce output, and reduce employment. The Act creates very high marginal tax rates for moderate income families. If we could have the first slide to demonstrate that. Moderate income families are going to discover that they get to keep less than 40 cents of each additional dollar they earn as a result of the phasing out of the subsidies for health care as well as other taxes. In addition, the Act creates a bizarre system of subsidies. There is no help in the legislation for $10, $15 an hour workers at McDonald's and Wendy's and Walmart and corporations like that. No additional help at all. And yet, if one of these employers decides to completely end its health plan, all of those workers can go over to a health insurance exchange and get from $10,000 to $15,000 of subsidies and maybe even more. These subsidies, by the way, are in danger of causing a complete restructuring of business, not for sound economic reasons, but just in response to the subsidies. If I could have the second slide. Economists at Stanford and the University of Chicago have created an uncertainty index, and they have found that we're now at the highest point that we've been over the past 30 years. They have concluded that public policy uncertainty is responsible for the loss of 2.3 million jobs over the last 4 or 5 years. And one of the reasons for that is the Affordable Care Act. Employers, if I could have the final slide, employers are responding to these conditions in certain ways that create a jobless recovery. What has happened is that hours of work have actually increased. In terms of the number of hours employees are working, the recession is over. We're back to normal. What's not normal are the number of people being hired. In terms of being hired, it's as though the recovery has not even begun. Under the Affordable Care Act, there is no penalty for having employees work additional hours. There are penalties for hiring additional employees. And let me just say something about the Massachusetts experiment, because I've looked at it. It hasn't bothered employers very much because all the expansion is in terms of subsidized insurance. All the newly insured people are either in Medicaid or they're getting subsidized insurance. They're not getting additional insurance from employers. And contrary to the statement you just heard, nobody's getting more health care in Massachusetts today. There are no more doctors. There are no new nurses. There are no new clinics. It's the same amount of health care is being delivered now as was delivered 4 or 5 years ago. More people are going to hospital emergency rooms than before the reform was passed. More people are going to the community health clinics. Basically, people are going to the same places they went before. They're getting the same care that they got before. And all that's happening in Massachusetts is we're just moving a lot of money around. Thank you, Mr. Chairman.
Mr. Goodman, do we know how many people will lose their health insurance because of the government takeover of health care?
No, we don't, but it could be as high as 80 million.
80 million.
I assume you mean lose their employer-sponsored.
Employer-sponsored.
Yes, yes, it could be very high, much higher than the Congressional Budget Office has estimated.
Taking that in consideration, what will be an overriding economic impact of the takeover of health care to our economy, to our businesses?
Well, as I said, we're imposing heavy labor costs on every employer in America, and if they don't bear that cost, then they have to pay a pretty substantial fine. We have $500 billion in new taxes, which the way they're imposed is going to reduce investment, reduce growth, reduce output. And as you point out, people are going to have to switch where they're getting their health insurance because employers are going to find, in many cases, it's just cheaper to pay the fine and send the employees to an exchange where they can get very, very substantial subsidies.
Does this potentially add, based upon the economic impact, add to a significant increase in debt crisis simply because of the health care reform bill?
Well, the Affordable Care Act is not paid for, and that's a point that hasn't been made yet in this hearing, that half the cost of the Affordable Care Act is paid for by cuts in Medicare spending. And yet the chief actuary of Medicare has said that if you go ahead and do this, you're going to have 1 out of 7 hospitals go out of business before the end of the decade, and senior citizens won't be able to find a doctor. And the prediction, apparently, by the actuary's office and by the Congressional Budget Office, they don't put it quite this way, but they keep putting out these alternative forecasts, and what they're really saying is, we don't believe Congress will stick with this. You didn't really pay for this bill. Okay?
That's amazing balloon in the sky with all sorts of uncertainty, isn't it?
Yeah.
Except the certainty that we can't pay for it.
Chair would now recognize the gentleman from Tennessee, Dr. Desjardins.
Thank you, Mr. Chairman. I'm just sitting here listening to all these numbers rattle through my head, and I mean, Massachusetts care just sounds almost too good to be true. We're about to implement a law that, in my experience in health care, cannot bring down costs when you're adding more recipients and not ration care in some form or another. We've got to something's got to give when it comes to the cost of health care, because the Affordable Health Care Act does not do anything to address cost containment. Health care costs are rising, so I don't know how this is going to be cheaper, but we're fortunate to have a number cruncher on the panel, Dr. Goodman. Maybe you can explain, whether or not Obamacare is really affordable for this country, and why is the care in Massachusetts so much better than what we're projecting for this?
Well, I want to start with Mrs. Miller's company and her employees. There is nothing in the Affordable Care Act that does anything to help her or her employees afford a $15,000 family policy. There's nothing. There's no new subsidy, no new tax break. It's just a law that says if she and her employees can't come up with $15,000 for a health plan, they're going to be fined. How does that help anyone? It doesn't. Now, in Massachusetts, again, the expansion, the way they cut the uninsured in half was not by going out and forcing employers to provide a lot of new health insurance. They cut their health insurance, uninsurance rate in half by putting most of the people in Medicaid, and the rest of them are getting highly subsidized insurance from the state. So this isn't affecting employers very much. But also, we need to correct the impression that a lot of people are getting additional care, because there are not. And a lot of people in this room are confusing health insurance with health care. I was in Massachusetts last year, and I talked to a woman cab driver, and I said, how's the health plan working? And she said, well, she's on Mass Health, which is Massachusetts Medicaid. She said, well, I had to go down a list of 20 doctors before I could find one that would see me. And I said, are you going down the yellow pages? She says, no, this is the list Medicaid gave me. You can't give people more health care if you don't create more doctors, more nurses, more clinics, or deregulate the market so that it can more efficiently provide services. So Massachusetts made the same mistake that Obamacare is making at the Federal level. In Texas, we have 25% of our population uninsured. Now, we can go put them all in Medicaid, but where are they going to find the doctors? Where are they going to get more care? They're not. And so we're creating a promise more access to care, but we're not going to be able to deliver, and they haven't done it in Massachusetts. And I'll repeat again, more people are going to hospital emergency rooms in Massachusetts today than ever before, and the same number of people going to community health centers are still going there, even though they now are insured, and they're not getting more care.
Now, there was a study done by Goodman from Stanford and Hubbard from Columbia that says that the Massachusetts plan has caused health insurance to rise 5.9% more per year than the rest of the United States. Isn't that true?
It may be true that the study says that. That's not what my numbers show.
So you disagree with this study?
I disagree with that study, yes.
Dr. Goodman, can you talk about that study, and can you talk about where the disagreement is here?
Well, Massachusetts has some of the highest health insurance premiums in the whole country. I mean, it's right up near the very top. And it was a very misleading statement by Senator Wolf when he divided by state income. It also was a high-income state, but their premiums are among the highest in the whole country. They have not controlled health care costs, and they admit they haven't controlled them. There's nothing in the Massachusetts health reform project that even tries to control costs. But now they are threatening the state with a global budget. And what a global budget means is they're going to give you a certain amount of money and make you ration health care. That's what Massachusetts is very seriously considering right now.
Okay. And Senator Wolf is nodding his head no. Why is he, I mean, where are you basing your facts from when he's, just Dr. Goodman, why is he nodding no and as you're making that
Well,
statement?
John Gruber and everybody involved, including Governor Romney, admitted they didn't have any cost control that they put in place. And they acknowledged that. Just as the Obamacare legislation has there's no cost control in the Affordable Care Act. They just push that aside. They have some demonstration projects, but the CBO has 3 times said that what you're doing, these demonstration projects, is not going to control costs. So in Massachusetts, they're going to fall back on global budgets, and they've been pretty open about that's the road they want to take.
Okay, so you stated that Massachusetts actually has the highest health insurance costs. Is that correct?
Yes, but they also had very high costs before the Romney Care.
Okay, and has this made it the lowest cost or the middle?
No. It's still highest in the country,
So
near the very top.
Okay.
It's amazing to me that as more people seek health care, as more people live longer and receive care, as more doctors and nurses and medical technologists and other health personnel are needed, how could this not increase the economy?
Well, in the first place, there's no provision in the Affordable Care Act to create more doctors, more nurses, more health care. It's all about health insurance. It's not about expanding the supply of medical resources. And you have to remember that every dollar spent on the Affordable Care Act on health insurance for those 30 million people is a dollar that has to come from somewhere else. It's a dollar you take away from the seniors on Medicare, the disabled on Medicare, or the device makers, or the people who go to tanning salons. And when you take dollars away from those people, then they're not spending the dollars. So it's just, I'm surprised that Jonathan Gruber would say what he said, because I do have respect for him. But just shifting money out of one pocket and into another does not increase total spending.
As people are living longer, as they are consuming consumables, as they are using food, as they are using housing, does not this expand the economy?
Not if the dollars that they spend are taken from somewhere else. And there's also nothing in the Affordable Care Act that's going to make people live longer, because there's nothing in the Affordable Care Act that expands the supply of health care.
Well, if they receive more health services, and they are adequate and good, I think they will live longer, as I've seen people who die prematurely for lack of care. And I yield back.
Can I ask one further question of Dr. Goodman? You talked about 25% of Texas residents being uninsured. You said that without any indication that that's a bad thing. What happens to those 25% who are uninsured when they get sick? Do they die? Do they suffer? or do they use the same health care facilities and essentially have a subsidy, let the rest of the people subsidize them?
Well, they use safety net institutions, just like they do everywhere else. I don't advocate that. I mean, I like the idea of the universal refundable tax credit that allows everybody to have private insurance. And may I respond to the free market for health care? The international market for medical tourism is a free market, and it's growing very fast. And Thailand's competing in it, India, Singapore, but also we're getting closer to home. We also have within the United States a domestic medical tourism market, and that's what the Canadians are participating in. When they come here, they pay half of what you and I would pay for a knee replacement. And they get package prices, and they can compare prices and compare quality. Cosmetic surgery, that's a free market. LASIK surgery, that's a free market. Minute Clinic is a free market. So there are many individual health care markets that give you an indication of how a market can work in health care.
We were only talking about elective procedures and procedures that people could afford. None of us would be here. This wouldn't even be a conversation.
Yes, but
I think the gentleman can conclude. Go ahead, please.
If we gave everybody a refundable tax credit and gave them financial means to have decent catastrophic coverage and a health savings account, then people would have the wherewithal to participate in a free market for health care.
How much would that cost?
I think we can replace all the existing tax and spending subsidies with a tax credit that's, say, $2,500 for an adult, maybe $8,000 for a family, and that's enough.